Hello, thank you for allowing me to talk about mobile clinics and mobile care. I'm Dr. Raul Ayala. I want to talk to you today about mobile clinics and how we incorporated them into our residency programs and primarily in family and community medicine. We are located in Central California. We are delivering care to the most vulnerable communities in Central California. There's about 1.6 million people that live in Fresno, Kings, Tulare counties. And one important point here of demographic is that our Medicaid ranges from 31 to 44%, with the average in California being 29%. And 10% of the people that we see are uninsured. Another important point there is that 20% of people in these areas live in poverty. We have been incorporating these programs for the last 4 years. It's really started with, how do we address some of the inequities of our communities? And addressing things like transportation insecurity, access to care, housing insecurity, education, and of course, poverty. I think a lot of this work has been in progress, but we're really happy that we're now got 2 mobile units, one going north, one going south, and the team care of our residents and our faculty, as well as our volunteer doctors, have been incorporated into this. We wanted to make sure that, we were incorporating the 6 core competencies that ACGME brings. Why? Because we know that our residents, as they're learning, as they're experiencing, we need to make sure that, we're using competency-based medical education, but also addressing some of the areas of professionalism, interpersonal community skills, and also systems-based practice, because we know that if we address the patient as a whole, we can incorporate the best practices for that particular population and utilizing the tools that are available to us to best care for those patients. A lot of the areas that we started with were, again, addressing our big agricultural community where we have patients that are uninsured. We do have areas of Central California that are still homeless, and addressing things like refugee and migrant camps where we can allow and take the best of what we have in our community clinics into these mobile units and going to where the care that needs to be provided. Some of the care that we provide through our mobile care is looking at just the basics of primary care with same-day visits. We're also partnering with our schools, our nonprofit organizations, providing physicals, sports physicals, but it's also medical management around diabetes, hypertension, hyperlipidemia, asthma, immunizations, and all through our point-of-care testing. Our mobile units are equipped with point-of-care testing and screening tools that will allow us to take care of patients in this fashion. And the other thing that we needed to do as we incorporated this into our community medicine was looking at clinical algorithms to allow us to have the best practice in a team-based approach. And so as you can see here in front of you, we started to really address some of the most common things that we were addressing within our clinics, within our communities, and that was medical management. It was around wound care. It was around questions of medications, or even just wellness with vaccines. So a lot of this has allowed us to partner with our community members, our community nonprofits, where we have incorporated food insecurity programs and also transportation. Because what this is allowing us to do is incorporate us into the rest of the healthcare system, where we can ask patients, we can address the chronic conditions that they may have, but also that we're addressing their social needs. And so we're able to transition them into our clinics, into our hospitals, and into the programs that allow them to have the best care that they can. Now, this program is a work in progress. We're really proud of this work here. If you're interested in mobile care, this was one way that you can incorporate that. And I'm really happy to have presented this to you today. Thank you.